The international community is talking of the SDGs now. The MDGs have been concluded in 2015. By and large, the performance of India in fulfilling the MDGs was average, not bad, but not exceedingly good either. But we did, I think, with respect to a few. Now the next challenge is the SDGs. And one SDG, that is number 3, directly relates to health, but there are 3, 4 others which have also bearing on SDG, on number 3, on health. So I think the major challenge is going to be how we can meet in a short span of 13 years what has been now projected to be a major change in the health of this country. And I think that really is not going to be a very easy thing. Another aspect I would like to touch upon is the whole issue of the IPRs, the intellectual property rights. Why? Because, as I said earlier, India could become a pharmacy to the world. Can we continue to remain so? And can we really provide medicines or formulations or generics at such low prices? And it is not only India, because other countries also would like to do that. Under the what is known as the TRIPS, that is the Trade-Related Intellectual Property Rights Agreement, which was signed in 1994, when the WTO came into being, there were several restrictions posed by the developed countries, because their interests varied from those of the developing countries with respect to TRIPS. So how do you do that? So in 2001, there was a major declaration called the Doha Declaration, in which India worked along with a number of like-minded countries to establish that the concerns of public health were more important than the question of just the availability of medicine. Because we are dealing here with situations which involve millions and millions of people. The diseases are also of that nature. We talk of type 3 diseases. The diseases which are prevalent in the developed world are again of different nature. So we are not denying the contributions of the developed countries or their positive role in this regard, but their priorities would be different from that of the developing countries. So flexibility was introduced under the 2001 Doha Declaration, which now enables India and a number of countries like Argentina, Brazil, countries in Southeast Asia, to produce medicines under that flexibility, under the TRIPS. So I think this is an area which will have to be very closely guarded. I'm aware that number of you are from law school here, or yesterday there were a large number of schools. I think you need to study this very carefully. I think the whole issue of patents, particularly which relates to pharmaceuticals, will be of tremendous importance to India. And I think, unless we are able to provide medicines to our large population at that particular rate, we will not be able to do that. In the capacity building field, which will be our main strength, because we have the people, we have the trained, we have the educational institutions. I think how quality of our doctors will be improved, nurses will be improved, how those courses will be rationalized, all that I think of course needs to be seen. And there the constant HR training I think is required. We don't seem to be giving adequate attention to this, because our doctor has to be better than other doctors. He has to be properly trained. You just can't say that he is an Indian doctor, he will do better in Africa or in South America or in Asia. In those countries also, they are now advanced institutions. As I said earlier, we need to really look into ourselves, because we very often tend to think, oh, we have so many doctors, we have so many institutions and so on. But just let me give you some sobering statistics. We have the largest number of hypertension patients in this country, in the world. Maximum number of diabetes patients, I think. We are probably second to China. so many mental health people today, patients. We, of course, have some notable achievements like eliminating polio, but just now we heard very distressing statistics with respect to children. So this is the state of affairs. We have to improve ourselves. Fortunately, we are living in a, as the title of the conference also mentions, in a globalizing world. And in this globalizing world, in the last just 5, 10 years, tremendous developments have taken place. And I personally believe they are very positive developments, particularly with respect to connectivity. Just take the case of India. In last 10 years, maybe from 50 million, we have 1 billion mobile phones. I think that kind of connectivity is available today in India. The internet is now spreading all over. So this is, I think, a situation which we all need to celebrate. Celebrate for finding solutions to our problems. What is technology meant for? Technology is not just the hardware or the equipment. Technology is a tool which enables us to find solutions to the problems. Gives us efficiency to resolve an issue. And therefore, I think these are the tools which are available today when we talk of healthcare diplomacy. Well, we talk of India's 1% in government expenditure on of GDP on health, which is abysmally low when it compared to developed countries, where it is about 6%, 5 to 6%. Even Bangladesh, Sri Lanka, and Southeast Asian countries spend far more than India. I think we need to raise that level of expenditure from 1% to say 2.5 to 3%. Of course, in India we have nearly 70 to 75% of expenditure in public sector. I think this is also something very different from a number of countries in the world. I believe only the US has more expenditure in terms of private sector participation than government. Even European countries do not have that. So I think these are some of the areas for diplomacy. Certainly we should think in terms of projecting it as an achievement for India. We should try to contribute. We have the big asset of IT, which should be fully harnessed in working towards our own improvement as well as our collaboration with outside world. So with this, I would like to now ask the audience if they have any questions about all the 5 speakers, the panelists who already spoke before. And I would request then the panelists to please reply to those questions. You had something else to suggest? You were asking me? No. Please raise your hand, and I think the mic can be given there.
Are there any questions? Please introduce yourself, and also if you could, mention the name of the panelist.
Good morning. I'm Dr. Pamela Fernandez. My question is to Mr. Ofrin. So we are aware that Japan has the best EMS response in the world. And though it is being run by the government, it is largely the civilian doctors and nurses who participate in the program. So why is it that in India, and not just in India but everywhere else, civilian disaster preparedness is lagging behind compared to Japan or New Zealand?
It depends on your system. That's what I've been saying, that it's up to the country's own policies and its system in setting up their own emergency medical teams. In Japan, it is more of a national system versus thinking that they will deploy people. That was much later. Their whole idea was to prepare for their country for a possible big disaster, a big earthquake. because Japan is very prone to earthquakes. So their system is nodal hospitals in different provinces and teams around that. But each of those hospitals have to be seismic proof. It was fairly recent in terms of training medical teams that would be deployed. They do have both civilian and a military teams that get deployed as well. So it's not either or. It's not something that you can prescribe to countries in terms of a certain protocol, or it's not one size fits all. So it's really your system.
I'm Dr. Samita Zadhav, Deputy Director of Symbiosis Institute of Health Sciences. We recently performed a study, that is the DREAM study, on the international students as well as the Indian students who are studying at various institutes at Symbiosis. And it was found that our learning environment was good. The faculty, of course, the experience to the students were good. Now that we have so many international students coming into India, we would request the panel members, to advise us and suggest on various methods on how to encourage more passengers coming from cross borders.
Dr. Offren, would you like to answer that one?
I think all the panelists can. I think you meant, how do you encourage more students, international students, to come to?
And what kind of environment can the Indian government give us with more, students coming in?
Well, I think it's more of, I have a previous life in the university, but my life was more of open and distance learning. So if you really look at learning, adult learning, it's all about now blended learning. There's something with your self-learning, what media appeals to you, plus a face-to-face. So I think in terms of creating an environment for more students, more international students, it's really to look at different types or mixed modes of learning. That, to me, is my personal belief, that if you have more of these different types of learning, then you will attract more students, because there's a mix of different methodologies, but also in terms of testing, evaluating students. It's not really just exams. In some cases, it's more simulations, real-life experience, etc., mentoring, coaching. Things like this are, for me, would create a different environment for more students to come.
I think if I can respond to your question, and if I understood your question correctly, how to get more students in Symbiosis Institute. See, I think there has been tremendous change in learning with the advent of IT. So now, many of the courses are offered through distance learning, and more importantly, many free online courses have come up. And some of those courses have become very popular. Some examples are EDX, Khan Academy, Coursera. So these have become, say, global standards. Therefore, if you have to be in the forefront of getting the international attention, international students, then you will have to invest more on the innovations, so that many of the students can take up the courses with minimal cost, and that has to be on the cutting edge, on the forefront of each and every subject. The second thing is that I do not know how that is going to be feasible or not. I mean, in a globalized world, until and unless you are the leader in that particular subject or in that particular discipline, you will not be able to attract as many students as you want. Many of us, we aspire to study in some of the best universities of the world, because they are the leaders in that particular field, whether it is Harvard or it's Johns Hopkins in case of public health, or London School of Hygiene and Tropical Medicine. I mean, they have their own advantage, they have their own brand name, and they are the leaders for the whole world in that particular field or in that particular category. Now, in the Indian context, that is going to be too ambitious, but then until and unless you aspire for that level, I don't think that we will be able to attract many more international students, because the technology, the environment is changing very rapidly. So that is what I'd like to say.
Thank you, Dr. Bhuyan. Are there any other questions? Lady at the back.
Good morning, all of you. I'm Captain Anita from Armed Forces Medical College. And my question is to panelist Mr. Ogburn. So my question is there's a huge difference between what we plan and what is on ground. So in your country, I mean, what are the check-on methods you use?
Who is your question addressed to?
Mr. Ogburn?
Dr. Afrin?
Yes.
Case in what context is the plan and what's on ground? What were you mentioning?
Plans we are using for whatever the SDGs and MDGs that we plan on ground, and what we plan on papers and what is actually happening on ground. There's a huge gap between the two.
Yeah.
So the check-on plans, what you use in your country.
Well,
Hope I'm clear.
yes. So many countries have a different approach in achieving those SDGs. In some countries, it's a multi-sectoral interministerial committee that does it. I was just in Indonesia, and for them, they even brought the private sector as part of their SDG committee. There's a sector on the academe and civil society plus government. So they've tapped philanthropies, for example, rich businessmen who are into giving. Now you can do that in India. The CSR law taps that area. So, and that's the whole point. There's a difference between the goal and what's on ground. You have to bring what's on ground to where you want to reach for the goal. So it's again, different countries having different systems in terms of achieving that. In some countries, smaller countries like Bhutan, they did not do a huge plan for all SDGs. They picked the ones that are priorities for their countries. Again, depending on their own capacities or what they perceive to be their priorities. So, but the whole point is that you make a plan so you reach the goal. The gap on the ground is what the plan should address. Thanks.
I would like to add, in answering this question, I think we should try to adopt best practices which are available. And I think that should be the study or research as to what these best practices are available outside. It doesn't matter which country, even if it's a small country, a developing country is doing that. I think it is worthwhile to see their experience, their difficulties, and how they have been able to resolve those problems.
I would also like to add, Dr. Afrin just spoke about philanthropies. I think UNICEF is also working with a lot of corporate foundations, if I'm not mistaken. Dr. Bhuyan?
In terms of the MDGs and SDGs, actually, once the country signs that, say, framework, then it becomes a responsibility of that particular country to report to UN on a regular basis. For example, say Government of India has been reporting on the progress of MDGs on a regular basis to United Nations, what has been the progress. So there's an annual report which is sent. Similarly, for planning for SDGs also, we have several planning workshops between the government and the United Nations. So the Ministry of Statistics and Planning at Government of India level is the nodal agency for coordination with all these UN agencies, whether it is WHO or UNICEF or UNDP. And then for formulating the goals, for formulating the indicators, and for tracking the progress on a regular basis. Because on SDGs also, all the countries will have to report to UN as to what has been the progress. So there are several consultations, there are several meetings which are implemented all the time, both at the Government of India level or at the state government level, to actually formulate the plans, determine the indicators, and then monitor the progress. And the government has to report on a regular basis to UN on the progress. I do not know whether I answered your question correctly or not.
Yes.
Hello, good afternoon. My name is Prema from Bangalore. I am doing my MBA in healthcare. I'm an Ayurveda doctor. So my question is to Miss, the person who spoke of.
Mrs. Neela Lal.
Yeah, Neela Lal. I'm sorry, ma'am. My question is, you said medical tourism is concentrating more on attracting tourists for well-being and all, and you're working with Ayush for this. And in India, we have seen there are so many people opening up the spas and well-being centers just for the business sake. And many doctors, Ayurveda doctors, they end up practicing allopathy. So my question is, what are the steps taken to restrict that unhealthy practice, and how do you encourage doctors to practice their own system?
Yes, so as I mentioned in my presentation, that this is basically an unorganized sector, and there is no control over spas opening up at every lane, every building, and there is no control as such. But NABH has been assigned this task of accreditation of all these facilities. So the guidelines are already prepared. They are already in the website of NABH. If you want, you can go through them. And every activity has to be registered now. Plus, we are also preparing guidelines which will be launched on the 21st of June, which brings the entire activity under wellness tourism under the ambit of these guidelines. So every activity will need to be registered henceforth. And the training process also.
Is the lady there?
Good morning, everybody. My name is Dr. Sujia. I'm coming from North Carolina Central University, US. Being born and brought up here in India and studied from here, and having a lot of experience teaching in India and various colleges, I have the experience, rich experience of teaching methodology here, and then as well as working in Middle East and US. I strongly agree with the panel members, what they were suggesting about the teaching methodology of blended learning and other things like online learning. So we were having a workshops, able to conduct some workshops. So here the methodology, what most of us prefer is like auditory learning, whereas in US, in other places, it's short workshops and hands-on and more of visual. So they may not be able to sit for long hours. And then whenever we plan for your students, like when you want to attract them, if it is something like face-to-face and if short duration, and please choose the season. I came along with another delegate, so she was not in a position to tolerate with our heat and the system. So people may become sick, and then it becomes too much, pressure on for us. I'm just scared now. I brought her, so till she goes back, I'm under pressure. So these are the things what we have to take in care. So this is my suggestion. Yeah, you can work out on these things, like taking the technology aspects and culture and other aspects. Thank you.
Thank you, ma'am. We have time only for another 2 questions. If I think the lady there had put up her hand first. Okay, please.
Yeah, my name is Dr. Payal Shah. I'm from Ahmedabad. I'm an Ayurvedic doctor. So my question is, I'm posing my question to Mrs. Lard. So, as you said, even the other doctor asked that we are attracting a lot of medical tourism patients. And I think most of the patients go to corporate hospitals, right? All these medical tourism patients. So this money goes to private people. So do these corporate hospitals use this money which they acquire from the medical tourism for any upgradation for the people, for the patients of India, for the needy patients of India? Is there anything, any provision used, put up by the government that use this part of a certain amount of money for a certain percentage of beds for the needy patients of India? Yeah.
Ma'am, if I'm not wrong, it already exists in most of the hospitals.
Since I don't know, I'm just asking
Yes,
you.
it does exist in most of the hospitals.
Okay.
Plus, there is also a CSR component, which all commercial bodies, all commercial houses, corporate houses are already undertaking. Plus, to give some more inputs on this, big hospital chains have already set up Ayurveda centers, though they are dealing with the surgeries and the other part of the medical care. They have also set up the yoga centers, the wellness centers in the hospital itself. So they are also catering to that sector now.
We'll take one last question and we'll have to close the session.
Yeah, myself Sejal Shah. I am from Baroda. I am working with a multi-specialty hospital in Baroda. My question is to Neela madam. Actually, I just want to ask, we are small-scale hospitals, but every facility and well-equipped hospital. So how we can participate in medical tourism?
Ma'am, first of all, you must approach the NABH. Are you accredited by NABH?
We are trying for the same. We have ISO. We are trying for the NABH.
Once you are accredited hospital by this organization, you automatically go in the list of accredited hospitals of the website of Ayush, NABH, and also an organization called SEPC, which is Service Export Promotion Council, which also deals with all the services that are offered, the service industry basically.
And can we have provision of tie-ups? If you see insurance company are tie-ups for so many hospitals, reputed hospitals.
Once you are accredited, everything
we
will
are
fall
on
in
panel
place.
of medical
Absolutely,
tourism. Yeah,
yes.
Thank you very much, madam.
I mean, I would request them to circulate or give my email ID. I would welcome any query and I would answer any query.
Thank you, madam.
Not
Thank you
at
very
all,
much.
Not at all.
Sorry, we're really running short of time, but I'm sure your questions are most welcome. Maybe you could write in. Dr. Jadhav, maybe we could create some kind of forum so that this dialogue can continue. Well, this is just the beginning of this dialogue. We're really happy that you found the session interesting, and our distinguished panel has in fact elaborated the linkages between healthcare and international relations. I would like to thank all of you, my distinguished panelists, Dr. Bhuyan, General Behra, Dr. Afrin, Ambassador Devre, and last but not least, Mrs. Lad. Over to you.
Thank you all speakers for your wonderful, insightful, building health relations, strong international relationships across the globe. Thank you, ma'am. Now I request Dr. Samita Jadhav, Deputy Director, Academic Symbiosis Institute of Health Sciences, to felicitate Professor Shivali Lavale. Thank you, ma'am. I would request Professor Shivali Lavale to kindly felicitate our speakers. Ambassador Sudhiti Devre, former India Ambassador. Dr. Rodrigo H. Offering, Regional Coordinator, WHO, Southeast Asia Regional Office, New Delhi. Ms. Neela Lad, Deputy Director General, Department of Niche Tourism, Ministry of Tourism, Government of India. Dr. Khanendra Bhoyan, Health Specialist, UNICEF. Major General Sanjay Behra, Commander, Officer Training College, Army Medical Corps, Lucknow. you, ma'am. Thank you all. After this insightful session, you all may proceed for a restoring and stimulating cup of tea. Please join us at 11:30 for the session on healthcare innovation and entrepreneurship taking place at Convention Hall and healthcare integrative approach in Indian setup taking place at auditorium. Thank you.